Welcome to our practice session on CPT codes, where we will sharpen our skill and test our knowledge in medical coding. Welcome back to my YouTube channel. If you are new to my channel, welcome to MedCode Insight. Hi, I am Nishaba, a certified medical coder. In the previous videos, we covered the procedure codes from pelvis to hand region. Today, we will putting a learning into an action with set of practice questions. Let's get started. Our first question is: a 78-year-old man who suffered from uncontrolled diabetes mellitus and hypertension was suffered an intertrochanteric fracture of right hip. The patient was taken for emergency surgery where he underwent complete arthroplasty of the right hip with insertion of cement and rod. The anesthesiologist provided anesthesia to the patient and monitored the patient throughout the procedure. Proper anesthesia coding for this procedure. Option A with service code 01202 along with modifier P1 AA and add-on code 99100. Option B with service code 01215 along with modifier P3 and AA and add-on code 99100. Option C 01214 along with modifier P3 and AA along with add-on code 99100. Option D with service code 0100 along with modifier P3 and AA and add-on code 99100. First, we will eliminate the option on the basis of correct physical status modifier. The modifier P1 is for a normal healthy patient and modifier P3 is for a patient with severe systematic disease. In this scenario, the patient is with uncontrolled diabetic mellitus and hypertension, which correctly matches with the physical status modifier P3. So on this basis, we will eliminate the option A. After eliminating option A on the basis of correct physical status modifier, our next step is to find the correct service code. The first service code is 01200 anesthesia for all closed procedure involving hip joint. Next service code is 01214, which is anesthesia for open procedure involving hip joint total hip arthroplasty. Next service code is 01215, which is anesthesia for open procedure involving hip joint revision of total hip arthroplasty. In the scenario, the patient underwent complete arthroplasty of right hip, which correctly matches with the service code 01214. So our correct service code is 01214. Our correct option is option C with service code 01214 along with modifier P3 and AA and add-on code 99100. Our next question is: what is the appropriate code for a 72-year-old male with a history of severe asthma is placed under anesthesia to have a long tendon in his upper arm repaired? Option A with service code 01712 along with modified P4 and add-on code 99100. Option B with service code 01714 along with modified P3 and add-on code 99100. Option C with service code 01716 along with modified P3. Option D with service code 01714 along with modifier P4. First, we will eliminate the option on the basis of correct physical status modifier. The physical status modifier mentioned in the options are P3 and P4. P3 is for a patient with severe systematic disease. P4 for a patient with severe systematic disease that is a constant threat to life. In this scenario, the patient is with the history of severe asthma, which correctly matches with the P3. So on this basis, we will eliminate the option A and D. After eliminating option A and D on the basis of P3 physical status modifier, we will eliminate the option on the basis of qualifying circumstance add-on code 99100, which is for the extreme age younger than 1 year or older than 70 years. In the scenario, the given age is 72 years and the mentioned service code is not among the four combo codes. So we can use the qualifying circumstance add-on code 999100 along with service code. So on the basis of this rule, we will eliminate the option C. In the given scenario, the service provided was repairing of long tendon in upper arm. It correctly matches with the service code 01714, which is anesthesia for procedures on nerves, muscles, tendon, fascia, and brucea of upper arms and elbow, tenoplasty, elbow to shoulder. So our correct service code is 01714. Our correct option is option B with service code 01714 along with modifier P3 and add-on code 99100. Our next question is what is the appropriate code for a patient who had regional block anesthesia provided for carpal tunnel surgery? Option A is 01710, option B 00400, option C 01820, and option D 01810. We will eliminate the option on the basis of correct service code. The first service code is 01710, anesthesia for procedures on nerves, muscles, tendon, fascia, and brucei of upper arm and elbow not otherwise specified. Next service code is 00400, anesthesia for procedures on integumentary system on the extremities, anterior trunk, and perineum not otherwise specified. Next service code is 01810, anesthesia for all procedures on nerves, muscles, tendons, fascia, and brucei of forearm, wrist, and hand. Next service code is 01820, anesthesia for all closed procedure on radius, ulnar, wrist, or hand bones. In this scenario, the service provided was carpal tunnel surgery. Carpal tunnel means wrist, as mentioned in service code 01810 and 01820. 01810 is for the all procedure done on the wrist, and 01820 is only for the closed procedure. On this basis, our correct service code is 01810, which is for the all procedures. Our correct option is option D with service code 01810. Our next question is Dr. David, an anesthesiologist, provided general anesthesia for a 72-year-old patient with mild hypertension undergoing an open arthroscopy of humeral neck. During this procedure, Dr. David was not supervising or monitoring any other cases. How should Dr. David report his codes for this case? Option A with service code 01630 along with modified AA and P2 and add-on code 99100. Option B with service code 01620 along with modified AA and P2 and the add-on code 99100. Option C with service code 01630 along with modified P2. Option D with service code 01634 along with modified P2. First, we will eliminate the option on the basis of modified AA and add-on code 99100. The modifier P2 was physical status modifier was mentioned in all the four options is for the mild systematic disease as indicated in this scenario. The modifier AA is for the anesthesia personally performed by the anesthesiologist. In this scenario, the anesthesiologist performed the anesthesia and he is only monitoring this service. So we will apply the modified AA. On the basis of this rule, we will eliminate the options C and D. The mentioned qualifying circumstance add-on code is 99100, which is for the extreme age younger than 1 year or older than 70 years. The mentioned age in the scenario is 72 years old, and the service code mentioned in the options are not among the four combo codes, so we will apply the add-on code 99100. After removing the option C and D on the basis of modifier and add-on code, our next step is to find the correct service code. The first service code is 01620, anesthesia for all closed procedure on humeral head and neck, sternoclavicle joint, acromioclavicle joint, and shoulder joint. One service code is for the closed procedure and one service code is for the open procedure. In this scenario, the patient undergoes an open arthroscopy of humeral neck. So our correct service code is 01630, which is for the open or surgical arthroscopic procedure. Our correct option is option A with service code 01630 along with modified AA and P2 and add-on code 99100. If you have any question or need further clarification, feel free to ask in the comment section or reach out via email. Thank you for watching. If you enjoyed the video, please like, share it. Your support means a lot to me. If you haven't already, consider subscribing for more. Click the bell icon to receive notifications. For more detailed guidelines, CPC mock exam related questions and notes, email me at my given email ID.